Uh, Good evening, everyone. First of all, my apologies. I was on another webinar and they kept pleading with me at two more questions, two more questions, two more questions. These were the Indian Revenue Service personnel, the customs, the sale tax, and the income tax officers of India, from all over India. So they were the ones, and they had questions kept coming. And this is no one more question before you leave, one more question before you leave. That's why I kept getting delayed. I had told them I'll go only at 3:15, so they overshot it by almost half an hour. I apologize for that. Not in my hands. I was here sitting in front of the computer only and answering the questions. Thank you so much for having me here. How do you want me to take it? You want me to, all of you must have seen the video. Do you want me to repeat some of it or explain it, the dynamics of it?
Yeah, I think everyone's watched the video, Dr. Varghese. I think there are a lot of questions on vaccination, which we're seeing. So if you want to start on that, or if you want to give a brief summary of the video, I'll leave that up to you.
Okay. I'll probably I'll not go into more details. I think the importance of, I didn't realize the importance of what I was saying, but I knew what I'm saying is going to be a game changer. I knew that. And I've been saying this for 8 months now. Santosh knows about it. But no one was listening to me. And I also know that had this been adopted 8 months back, we could have saved so many lives. We could have saved so many lives. And all this discomfort of oxygen saturation, all those would have been avoided. So the first thing is, the key thing in this disease is to understand. In fact, the first draft paper I wrote, you know what was the draft paper? The draft paper was the predictables in an unpredictable disease. The predictables in an unpredictable disease. So every report that we heard, it seemed to be so weird. Nothing medically seemed to be fitting in. So I tried to make a mess. Medical professionals made a mess out of the whole thing by adding more confusion to it, adding more hypothesis to it. So I looked at it from an outsider. I'm an orthopedic surgeon, I'm not a physician. So I have the advantage of an overview from outside, not from inside. Inside there is chaos there. Why? Too many patients, PPEs, face shields, patient on oxygen mask, communication is not possible. Doctors want to spend minimum time there and walk away as quickly as possible because they're scared they're going to get infected if they stay longer. And details of questioning and the medical interrogation that is part of a history taking was not happening the way it should have happened. What I did was talk to patients who were at home, tested positive, and I kept following up what happened to them. I would talk to them twice a day, not because I was trying to find out a medical history, paper. No, because they were also petrified. They were seeking someone to talk to and allay their fears. And in the process, I began to understand the disease. That is what happened. So in my talking, as I told people, so many people, in fact, it was in an interview abroad also, I said the same thing with Boston radio, that I called it my Schindler's List of people. So when somebody calls me up through somebody that I am tested positive, I said, okay, tell me your symptoms. I'll add you on to my Schindler's List. And I would then call them up twice a day, every day, till they are fine. Okay, so that is what helped me understand the whole process. And this helped me understand the clear predictables are related to the timelines of the disease. The second important understanding in my whole thing came from the Italian postmortem study. The Italian postmortem study clearly indicated the disease is not caused by the virus. It is a coagulation, not a pneumonia caused by the virus. It is a coagulation in the capillaries of the lungs. It is not a pneumonia caused by the virus. The pathology, the microscopic picture was not that of a pneumonia. Everyone thought it is a viral pneumonia. In viral pneumonia, you give prophylactic antibodies right in the beginning. So we need to look at it from that Italian early understanding 2 months down the line. that it is not a viral pneumonia, it is coagulation that is the problem. And why was coagulation taking place? That came up in early research, and coagulation was taking place because of autoantibodies, body's own antibodies attacking its own cells. Normally, antibodies attack only foreign invaders, foreign bacteria, foreign viruses, foreign fungi. It doesn't invade its own, attack its own cells. Here was a situation, the antibodies prepared to kill the virus attacks the body's own endothelial lining in the lung and attacks it, and therefore damages the cells in the lining of the blood vessels of the lung, and therefore you have irregularity, loss of smoothness, and clotting in these vessels. When there is clotting in the blood vessels, you have failure of blood circulation, which means failure of oxygenation, which means you will develop breathlessness if your lung is sufficiently involved. So this is the key understanding. First, the disease has an incubation period which is about 5. The early symptoms are because of the fight between the antibodies and the virus. And the antibody always wins. It is like a common cold. You don't die of a common cold. Normal people don't die of a common cold. The body wins always. So that is happening in the first symptom, 2-3 days, and that's it, you're fine. It is 80% belong to this category. 20% belong to the category where after 5th day, they develop fresh fever, most important symptom. High grade fever, 101, 102, 100.5. Initially it was 98 or 99, suddenly shoots up. Or they develop a congestion or the deep kind of a cough with nothing coming up. Harbingers of a dangerous turn in the disease. That is after 5 days, not before 5 days. So incubation period is 5. The mild part of the disease caused by the virus and the interaction between the virus and the antibody is 5 days. The dangerous turn is the next 5 days. So in fact, the second paper I wrote was Rule of 5 protocol. Somebody put it up on Facebook as Dr. Varghese's Rule of 5 protocol on Facebook. It was there on Facebook somewhere. So it went around the rounds of embassies. So people started calling me from embassies. German embassy, we heard about this. What do you think? I said, I don't know about it. Somebody else posted it. Oh, but is that your hypothesis? I said, yes, the hypothesis is mine. But the hypothesis is based on my understanding on what happens in the timelines of the disease. So the dangerous turn happens 5 days from the, so earlier wave we knew when they got infected. I went to this party, I went to this place and I got infected. This wave, nobody knows where the infection was from. Everybody in the family is infected, nobody knows where they got it from. So I stopped looking at the incubation period. I looked only at the first symptom and then go ahead 5 days. Your mild symptoms settle, you're fine, you're in the 80% corona warrior, clear, no problem. After 5 days, if you have fever coming on, if you have cough coming on, you have deep cough and a congestion or a little difficulty on the chest, breathing, that is the harbinger for a problem of a dangerous turn. And the dangerous turn is not because of viral pneumonia. Dangerous turn is because of cytokine storm causing clotting of blood in the blood vessels of the lung and preventing oxygenation of your blood in the lungs. This, in the next 5 days, there is a second wave. Why are the waves coming on? There's a second wave and the third wave. It comes in intervals of 4 to 5 days, 5 days plus minus 2 days. Why? Because it takes time for the body to create batches of antibodies. It releases one batch on the 5th day, another batch on the 10th day, another batch on the 15th day. It is like that. It comes in waves. And with each wave, you have deteriorating symptoms. So the patient becomes worse, goes on a ventilator 10 days from the first symptom or 15 days from the first symptom. Either he is going downhill and is going to be with his creator, or he is better. So those are the variations in the timelines that are important. And the timelines are clearly pathology identifiable. First pathology, antigen-antibody reaction between the virus and the body, mild symptom, enters through the throat, maximally in the throat, attack in the throat, sore throat, itchy throat, cough. Enters in the nasal mucosa, stuffed nose, no running nose like in a common cold, but mild symptoms. Then you have the symptom of body ache and myalgia because of the excessive energy requirement and the multiplication of the viruses. And also you have fever because of the antigen antibody reaction, fever. All explainable in the first 3-4 days and you're fine. 80% are fine. And then you move on to the dangerous phase. That's when you need to take care of the dangerous phase. How do you do that? You need to suppress the auto-antibody reaction, that is with steroids. You need to suppress the coagulation, that is the anticoagulant. Two important drugs. Do you need to give immune boosters? If you have balanced diet, good nutrition, not worried. Poor community, poor immunity, poor resistance, malnutrition, you may supplement with vitamin B, C, and D. Bombay, Chennai, Delhi, vitamin B, C, and D. You give them that supplement, and that's all that is required. Do you need to give antibiotics? No, zero need for antibiotics. Viruses are not killed by antibiotics, neither doxy nor azithro. Ivermectin, controversial. Some say yes, some say no. There is the final word is not yet there. So if it is something which I don't know, I don't like to give it. What I know certainly is two things are effective. One is the steroid and the other is the anticoagulant. These two things you may take. And these two things you don't take before. You take it before, you'll prevent the normal immunity from eliminating the virus. You prevent the normal immunity from suppressing the virus. So you do not take it in the first 5 days. After 5 days, if there is fever coming on, then you take it. And then only you take it, and take it for only a short period, a week or 10 days maximum, not more. Is that sufficient? No, it is not sufficient. You need to have the anticoagulant also, because despite the immune suppression, all immunity, there is still some immunity, and therefore still some coagulation. Therefore, you need to have anticoagulant. You given the anticoagulant, you suppress the immunity, your disease is suppressed. Does it clear everyone? No, it's not 100% clear. You still have some people with a massive cytokine storm. I may not be able to save them, but I may be able to save many of them, not all of them. Do they not all, do they need all of them need to go to hospital? No, all of them may not need to go to hospital. Do they all have breathlessness? No, all of them will not have breathlessness. Why? Because your lungs body has been created specifically. You have two lungs, like two kidneys. You can donate one kidney. You know, today morning also I saw a patient who was going to donate her kidneys. One kidney she's going to donate to her husband. So you can donate one lung to somebody else. You can manage 100% saturation. Digital sensor, 100% saturation with one lung. No issues. But what will be the issue? You'll be a little more breathless when you climb 2 flights of stairs. You'll be more breathless when you run. That's all. But your saturation will remain 100%. So can I manage with one lung? I can manage with less than one lung. Only 1/3 of both lungs are required for your normal day-to-day existence. But you can't jog, you can't do marathon, you can't do football, with the Barcelona Football Club. You can only do your day-to-day activities and manage that. Your saturation will not drop. That is clear. We know that from a biomedical exercise physiology aspect and from surgical aspect for lung transplant victims who are having one lung anesthesia. There we know very clearly they can manage with one lung, even less than one lung. Therefore, relying on saturation is waiting for your lungs to be ruined to more than 2/3 its normal capacity. That is when it starts dropping to below 95%. So don't wait for that. You need to start the anticoagulant, you need to start the steroid before your saturation drops. Saturation drops usually on the 9th day or on the 8th day or the 10th day. It is too late. It is too late because 2/3 of your lung would have been damaged. And that is when people say, we went to the hospital. In 2 days' time, he went on a ventilator and he's not with us anymore. My God, what a disease. You can cry, but you forgot your science. Your science told you that this is what is going to happen. You ignored your science. You started giving all kinds of empirical drugs empirically. What would remdesivir do? Remdesivir is created as an antiviral. If pneumonia is not because of a virus, why do you give remdesivir on the moderate and severe cases? It doesn't work. It works maybe in the early phase in controlling the viral replication and viral entry and the virus multiplication. It doesn't work otherwise. Tocilizumab is something which is supposedly efficient in controlling the interleukin levels. It is an anti-interleukin monoclonal antibodies. However, it has far too many side effects. It can cause serious complications. It can cause severe flare-up of infections. And therefore, if there is even a borderline suggestion of infection, you don't give it. And by the time these patients are in that level, most of them have some degree of some infection or the other. You don't want to take the risk. Therefore, what is left to you are just two drugs, steroids and anticoagulants, given at the right time, not before, given at the right time for the right time. At the right time is after 5 days. For the right time is week or 10 days for steroids and 3 weeks for the anticoagulants. Why 3 weeks for the anticoagulants and why not the steroids? Steroids are required because cytokine storms are there only for about 10 days or so, not more. They come on, but the autoantibody reaction, very mild ones, may last longer. That leads to coagulation, and that needs to be suppressed, and the prothrombotic phenomena lasts for 3 weeks at least. So therefore, you give anticoagulants for 3 weeks. People say, we give aspirin. No, it doesn't work. When you look at the blood counts of these patients, the blood count will show that the platelet level is low. Many of them platelet level is 28,000, 25,000 is the lowest I've seen. 25,000, that's very low. In dengue, it happens. It also happens in any viral disease, and it also happens in coronavirus illness. So if that is low, why do you need an antiplatelet? Aspirin is antiplatelet. It works through one, inhibiting platelet function, two, inhibiting the platelet numbers, the thrombocytopenic drug. But it still doesn't prevent clotting in your veins and in your capillaries. So you need an anticoagulant, definitely. Do not rely on aspirin alone. It doesn't work. Therefore, two drugs alone will work. Time it right and you're fine. But why do you have to worry about other things? Why? Because steroids they are diabetogenic. Because nature intended it like that. It's a stress protective drug. In stress, you need high glucose levels. So it's stress protection means higher level of body glucose. And that is what steroids cause. And therefore, diabetics have blood sugars shooting up to 500. Control that with a good diabetologist and insulin if necessary, or increased drugs or whatever. Good control. And anticoagulants will cause bleeding in esophageal varices, in bleeding piles and peptic ulcers. Therefore, watch out for that. Correct that. Under supervision, therefore, these two drugs under supervision, take that. That is the only way you can control the disease. Timelines, important. In the 4th to 6th week, there is one fourth category of illnesses. Mild symptoms, dangerous turn, secondary bacterial infection, which happens on the 4th, 5th day from the dangerous turn. That is after starting, that is when you need antibiotics. 4th, 5th day from the time when your dangerous turn happened, your fresh fever will come up, and that is bacterial infection. That is the time when you get lab parameters, CBC, ESR, CRP, LD, serum ferritin, interleukin 6, D-dimer, and maybe procalcitonin in some cases. You get the full works done in these cases. That's all that you need. And CT scan perhaps. No need for CT scan on the first day. No need for CT scan on the first day of symptom or on the first day of your dangerous turn. You do a CT scan 3 or 4 days after these symptoms have come. Despite that, despite steroids, despite your anticoagulants, if you still have breathlessness coming on, you need a CT scan to see the extent of damage. And the next level of CT scan will be after your recovery. You want to see, is there any fibrosis happening? Are there any persistent mnemonic changes which need intervention? But in 4 to 5 weeks time, there is a group of patients who have cardiac involvement. They'll say their heart rate is beating fast, like that, like a bird feather, or heart rate, sir, it is 40, it has gone down. These are patients who may need investigations. These are patients who have cardiac involvement, myocarditis, thrombosis in the coronaries. They need to be evaluated by a physician, checked up, and under expert advice would be supervised. So clear timelines tell you what action to do at what level. Appropriate action at the right time for the right patient will save patients from needing oxygenation, needing to go to the hospital. And I have seen patients who delayed taking of the steroid just by 2 days, and they went on a ventilator. Just by 3 days, and they are no more, they are history. I'm following up. I have my details. I pleaded with them, sir, please get into the hospital. No, 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 I am taking this homeopathic drug. He's assured me I'll be all right. I said, please, sir, heaven's sake, get back to the hospital. I'll take care of you. I'll make sure you're taken care of. He ran a factory. He was a wealthy man. He was a donor of mine. He refused to listen to me. He came after 5 days, which means 10th day from the first symptom. Within 2 days, he was on a ventilator. By 5th day, his history now. I felt miserable that I couldn't convince him to come to the hospital. So that 2-3 days delay can make a difference between being on a ventilator or being happily at home. So the timelines help you decide. And the decision is scientific based on actually what is happening to the pathology in your body. I'll stop here. Now come to the vaccination part. So if you don't have drugs to control the thing, what do we have? For all viral diseases, it is vaccination. You name any viral disease. If it is polio, look at polio. If it is rubella, look at rubella. If it is viral hepatitis, look at viral hepatitis. If it is measles, it is measles. If it is rabies, it is rabies. Rabies is the only vaccine which is given post-exposure. Do you know why? Because the incubation of rabies is several months. After dog bite, you get rabies maybe after 5 weeks, maybe after 10 weeks. By then the immunity is developed. But in this particular case, immunity develops within 4 to 12 weeks. Booster dose is 4 weeks, and in 12 weeks, give one dose, booster dose is 4 weeks, and in some vaccines it is 12 weeks or 8 weeks, depending on the type of vaccine that you're taking. And that will help you protect yourself. Because in this particular case, the incubation period is only 5 days. In 5 days, you do not develop antibodies to fight the vaccine, the virus. So you cannot have a post-exposure vaccine. You have to have a pre-exposure vaccine. And that is given right now. And if you think that you take it during a peak time of the infection surge, it doesn't work because your immunity needs at least 2 months to be effective. Therefore, take the vaccine well in time, maybe in the next wave if it happens. Then big hype about the next third wave. No one knows. I wish I was a medical astrologer. I wish I will enroll for that study, for that medical astrology. I'll be an expert and tell people on that. As yet, we have mathematical modeling, and we do not have a modeling for predicting future. We do not have a modeling for predicting futures. No one knows. If everybody knows about the third wave, where did they fail in the second wave? Did they predict the second wave? They had no clue it will be like this bad. They had no clue that the spike will be so bad. No one told us. No one prepared us on that. They said there will be a second spike. There could be a third spike also. I can say there can be a fourth spike also. So many waves are there. But there is no way of predicting how many times this wave will come back to you. So it is all conjecture. And on top of that, they'll say it affects all the children. How do you know that? There's no way of predicting that also. These are all fear psychosis created in the minds of people so that people are forced to take vaccination for children. 40% of our population are less than 15. 40%. That means 1.3 billion, 40% is over 400 million. So these are 400 million people, potential vaccine candidates. So any company would like to access them and give vaccine to them. Only catch is we don't have a pediatrically approved vaccine in our country. We will have to import it. So we will be dependent on imports for those pediatrically approved vaccines until we generate our own. So it is very nice to create a hype so that before our vaccines are developed, we are forced to import them. Please, we do not know. There is no proof that children will be affected in the next wave. There is no proof that the next wave will be how big or how small or how bad. Nobody knows. We are just creating a situation of a hype, and we do not know anything beyond that. So this is what I have to tell you. The vaccines, we have two. One is Covishield, which is Oxford AstraZeneca. Oxford is the university. AstraZeneca is the company. It has sub-licensed to the Serum Institute of India to manufacture it because it is a large manufacturing capacity. The vaccine is a virus, adenovirus based. Adenovirus is the common cold virus. Adenovirus based, non-replicating, which means it doesn't multiply, non-replicating protein spike based vaccine. So the spike of the coronavirus, which is the one it uses to enter the cell, is the one which is used as the USP, United Identification key for the vaccine, and that is used to create an antibody generation in your body by injecting this vaccine. It is given intramuscularly, 2 doses. Original interval was 4 weeks, but subsequently they found better response when it is given after 8 weeks or 12 weeks. So the current recommendation is 8 or 12 weeks after the first dose, you give the second dose. The Covaxin is a killed virus vaccine, killed by treating with a chemical and creating the vaccine, retaining all the stimulating antigens in the virus. And this then is injected and it stimulates the antibodies to protect you from the virus infection. So one is a killed vaccine, killed virus vaccine. The other is a living virus, non-replicating virus with a spike protein attached to it. Okay, so these 2 vaccines. The last phase 3 trial was completed on March 3rd, and therefore it has only got an emergency use authorization. The international approvals are yet to come. It has been applied for. It has not yet been received. Therefore, if your children are traveling abroad, you will need to take Covishield and you will not be eligible if you have taken Covaxin. A lot of people say, I've had the disease, so why should I take the vaccine? Yes, you've had the disease, but we do not know how much of a protection it will give you. I have in my over 350 cases that I've followed up, 3 cases which have got the reinfection after 5 months. So you can get infected after 5 months. So the idea of immunization is to see if you can prolong this. So if you give an infection person a vaccine, will it protect him? It won't, because it takes time for the antibodies to develop. If after 2 weeks, within 2 weeks, if you give, the acute antibodies that are generated will eliminate the virus vaccine that is injected. Therefore, you don't take it within the first 2 or 3 weeks. You wait for some time and then give it. The regulatory recommendation is wait for 3 months after the coronavirus infection before you can be given the vaccine. Can you mix different types of vaccines? No. If you've taken Covishield, Covishield only. If you've taken Covaxin, Covaxin only. If you've taken Pfizer, Pfizer only. Pfizer needs a temperature of minus 80 degrees to preserve it. That's a cold chain problem. And that nobody knows whether we'll be having the logistic capacity to take it all over our country. So that is what we are looking at. In our country, we are looking at the Covishield and Covaxin because they can be managed at the manageable room temperatures and given to patients. So this is about vaccines.
Excellent.
Questions?
Thank you, Dr. Varghese. So a couple of questions that are on the chat box. I think one of them a lot of people have asked is, how do we convince people, say domestic help, or people in our circles, a lot of people here from different NGOs, how do we convince, say, people who are not so educated about the vaccines? What are easy things we can say to convince them to take the vaccine?
Yeah. You see, the convincing is based on trust. The communication has to be coming from a person whom they trust. They trust somebody who means well for them. So if they don't trust a politician, they're not going to listen to him. If they don't trust a bureaucrat, they're not going to listen to him. It has to be somebody who's trusting them. And who are the persons who are likely to trust them? People who have been working with them for a long time. So if you all are community volunteers, you're working with communities, they will listen to you because they know that you mean them well. You wish them well. You miss them well on a long term. That's we've been associated with them for a long time. See, all of you have a critical role in convincing them. But what are the things that you're worried about? The drug that is given in any disease is given to an ill patient, isn't it? And many of them have side effects. Most drugs have some side effect or the other. You may even have an allergy. But remember, there is a difference between a drug and a vaccine. A drug is always given to somebody who has a disease. A vaccine is given to a normal person. So the safety profile of a vaccine has to be several fold higher than that of a drug. That is one important thing. So when you go through phase 1, phase 2, phase 3 trials, we are looking at one, the safety, we are looking at the efficacy, we are looking at several aspects of it. All the vaccines that have been approved are ones which have gone through all these phases. What we don't know is when we give it to millions of people, how many will have these side effects? And we don't call it side effects, we don't call it complications. The technical term used is adverse event following immunization. That is the technical term that we use for vaccine related problems. And most of them, as of yesterday, 1.3 billion people have been vaccinated against coronavirus globally. 1.3 billion. The number of adverse events have been comparatively very low. But look at the number of people who have died from coronavirus. Therefore, the risk versus benefit is what we look at in medicine. The risk of dying from the disease, risk of having a terminal illness, risk of illness becoming serious and depleting of all your financial resources. Even many people have sold their houses to get treatment, to get access to treatment. So if you want to protect yourself from that kind of a situation, a vaccine is effective and safe enough. That's all I can say. But the message should go from a trusted person.
I like that. Yeah. I think that always helps when someone trusted is able to communicate that. I think one question here about the vaccine is, and I'll just read it out. There was a video circulating from one of the experts in the vaccine world saying that the vaccine kills antibodies and people who have taken the vaccine will eventually become asymptomatic or symptomatic carriers. Is this true? How much truth is there to that?
Vaccine does not kill antibodies. Vaccine contains the spike protein or some other component or all the components as in the killed vaccine or Covaxin, which stimulates antibodies. So in medical terms, a vaccine is an antigen which generates antibodies. So that which generates the antibody is called the antigen. So here vaccine is the antigen which helps generate the antibodies. It doesn't kill antibodies. It never kills the antibody. It cannot. It only infects a cell, enters a cell, and replicating may be there as in poliovirus vaccine. Weakened poliovirus vaccine is a replicating virus vaccine. Here we have a non-replicating virus vaccine. It doesn't multiply in the body. So there is no risk to immune compromised people. You can still give it because it's non-replicating. People are worried about if your immunity is poor and the virus is living cold virus, will you have a bad cold? No. You can still have in the processing of the virus protein and the generation of the vaccine, you may have treatment with some chemicals to which you may be allergic and therefore you may have an allergy. You may have a rash, you may have a fever, but you cannot have the antigen killing the antibody. It will generate the antibody. So the antibodies may be of different types. The body has immunity of different types. Let me just explain. That's in that question has been asked. First is the acute antibody following an acute infection, which comes up within the first 5 days, which is what happens here. Is the first 5 days when you have the first symptoms of little cold, little fever, little whatever. After that, that goes down. It peaks in the early phase and goes down. That deals with the acute infection. But the chronic infection, the memory cells come in. They generate immunoglobulins that last a long time, sometimes a lifetime, as in smallpox. Once you have smallpox, you don't have smallpox again, it's a lifetime. Anamnestic response. Amnesia is forgetfulness. Anamnestic means failure to forget. Anamnestic response of the body. And therefore, you do not have smallpox against this. We do not know how long is this, time will tell. Remember, the vaccine it took years and years for vaccines to be developed. We have done it fast forward because of technological advancement, because of genetic coding, genetic manipulation. All those technological advances have helped us, and the computer age and the artificial intelligence and all those things. So we have fast forwarded it. the historical history of this vaccine is short. So long-term effects, how safe, how long, we do not know. That transparency should be shared with everyone. But given that, we have to tell them that the vaccine is safer than having the infection from the virus. That is what message that we do. So the long-term antibodies are one component which will help you have long-term. So if you take the vaccine during the first week after your COVID infection, you still have some circulating acute antibody. They'll destroy the vaccine. So you will not have the immunity. That is why you wait for 2 to 3 weeks and then only you take the vaccine. There are some people ask me, sir, हमारा तो corona negative था. We have to travel abroad. Can we take the vaccine? I say, how many days? Sir, it is only 2 weeks. I said, wait for 1 more week. After 3 weeks, go and take it. Don't take it before that because it will not be effective. If you travel abroad, no, take it after 3 weeks, not before. Oh, then it's okay then. But the regulatory thing is 3 months. That is because of availability of the vaccine, nothing else. There is one more cell-mediated immunity that is operating, of which we still don't know anything, which is the long-term memory T cells. They also, you may have zero antibodies. Some people panic. Oh, sir, I took the vaccine, no antibodies at all, 0. 7, low. They panic. Will I get the virus? No, not necessary. Because there may be stimulation of these cell-mediated immune cells, which will kick in and bring in the antibodies whenever it is required. So our human body is an absolute marvel of a creation. Too many things we don't understand. Doctors want to believe that they know everything, they know nothing.
I don't know whether that last statement should give me hope or scare us a bit.
No, when I say nothing on a percentage basis, one little piece of RNA has brought the whole world to its knees. And we are still studying the virus, which means we know as a percentage of, we think we know the world, but it's like the universe. How much of the universe do we know? Very little, isn't it? So we think we know the world on our body, but actual knowledge in terms of micro, nano levels is very minimal. That's all that I'm saying. I'm not saying we know so much more than what we used to know. And all this is compressed in the last 50 years of history. Don't forget that. We have been there for 4.5 million years. Human existence is 4.5 million years. And in the last 50 years is what we are understanding has evolved. Huh? Don't forget that.
Nice. Thank you, Doctor. I think you've answered a whole bunch of questions just by talking about the vaccination. I think I want to try and put together a couple of questions here. I think one is, I don't think any of us were ready for the second wave, right? And like you're saying, you don't feel that, I mean, you can predict what is to come, but would you be able to give us some insight into what does life look like post-vaccine, right? Can we just go around as normal? After we've taken both our shots, do you see life resuming, or do we still need to be cautious? Can we get infected? I think, what does life look like for the average person, say 3-4 months? Or are we still looking at spikes? You'll get into some lockdown. What are the options? What does our future look like a bit? I mean, at least some, I know you can't predict it.
Yeah. I like the statement that the further back you look into history, the further ahead you can look. And that's when I look at the influenza flu of 1918. It lasted 2 years, didn't it? Without any vaccine, without any knowledge of what needs to be done. Then also you have the pictures of all the masked people. You remember? They also had the shields. Lots of pictures, I have them. A lot of those black and white pictures are there. Whole class is wearing a mask. They also thought that it spreads through that and they did that. But it still took them about 2 years before herd immunity took over and the virus met its strong buddy whom it couldn't beat to get infection. So if you were to look at the spikes for future, those cities in India where we have had massive surges, massive spikes, I think they can be reasonably comfortable. They'll have a reasonably comfortable life. However, there may be still minor variants that will come up, and virus has an evolutionary advantage of millions of years over us. Don't forget that. And virus has also an advantage in terms of its life. A virus becomes million from one in one day. A human being from two, from a couple becomes at best three in 60 years, not more. So for an evolutionary mutation to become advantageous to the human being will take us several 100 million years. Don't forget that the virus has the advantage of multiplying so rapidly that if mutation will happen, there will be mutant strains. So that is why you may have a kappa strain, or you may have a theta strain, you may have an omega strain, wherever. We don't know where the omega will be, where the omega strain will come from, we do not know. But we wait and see. By and large, one strain protects you reasonably from a serious disease of the other variety. That has been very clear. By and large, it is protecting. By and large, the vaccine is protecting from a serious illness in a strain which is different. That is there. So looking at that, I would wait closely for the next coming year. Spikes will not be happening in all the areas. Spikes will happen in newer areas. Spikes will happen. In fact, my prediction, I don't know whether I can show you this. This chart I have been showing in my lectures and my media people. You know what is the first here? The wave that you see here, the small mountain that you see, it's symmetrical. It is the first wave of August, September, October, November. This wave, when we were here, I told that the descent will be as sharp and the virus will be having its peak effect maximum 30-40 days. And I have told this to journalists and I keep sending them this picture. I tell them, tell me, am I right or wrong? They said, yes, sir, you were 100% right. I know, because natural curves which are unimpeded by any intervention, and none of that has worked, no lockdown has worked, will be symmetrical curves. It's simple statistical curve. It goes up and comes down symmetrically on either side, and that's what has happened. It has come down similarly. There will be similar spikes in newer areas. It will come up. So people need to mask. I keep telling them, can we give out the mask? Not for the next 1 year. After that, we will see the pattern and then take a call. By then, hopefully, either there'll be herd immunity from infections or herd immunity from vaccinations, and that will be sufficient enough. I don't think life will be changed forever. Nature always evolves. It is beautiful. It is fascinating. And science is also fascinating. So until then, learn how to get the mask right, completely covering your nose and your mouth. Today morning also, time and again I have to tell the patient, no, don't put it like this. They come to me, start talking like this. No, I tell them, I may be infected. 60% of my staff were infected. 60% of my doctors, my department, ortho department, had the infection from the virus. I don't know, God's mercy, I am protected somehow. I do not know why and how. Maybe I had it in the beginning. I don't know. But I am so far lucky. But I don't know how far the luck comes. So what do? I put it like this completely, it never comes off. And I never touch this part. Virus may be sticking here, or I never touch the inside. And if I touch the inside, what do? I always use this. And liberally, not a small bottle which they carry around, put 2 drops here and then do this. No, doesn't work. You have to have it all over your hand. All your fingers, do it nicely. That's what is supposed to be done. Nothing else. So this is how you protect yourself. Don't touch the mask or anywhere else other than the string. Don't have your nose uncovered, nose and mouth covered. And anywhere you touch the mask, sanitize your hands. And a normal human being touches his face 20 times in 1 hour. 20 times. That behavioral scientists have done the research. That's not part of corona research. 20 times in 1 hour. That is sufficient for you to spread the infection from one person to the other.
Nice. Thank you, doctor. We're running out of time, and there are probably We've got enough questions for another day. Couple of questions I've seen a lot of is Covishield versus Covaxin. Is there a difference? I feel like it's a beauty pageant out there, each deciding is it Sushmita, Aishwarya Rai. So, what are your thoughts on Covishield versus Covaxin, or is it any vaccine, whatever you get? And how long is the effectiveness, or do we not have enough studies for that?
Yeah, definitely the protection is there for, we know so far that at least 6 months or so it is there. Whether it will last 1 year, how good it will be, we do not know. We'll have to watch it. Which is better? Each one has a different component. The preparation of Covaxin needs a certain chemical to kill the virus. Okay, the virus is killed by, in this particular case, earlier it used to be killed by formaldehyde. They don't prefer that. In this particular thing, I think they're using beta-propionolactone. So some people are allergic to that. So if you're allergic to beta-propionolactone or some of those synthetic cosmetics and all which contain that, you do not use it. Then you can use Covishield. Covishield has a tendency to produce a clotting problem in 1 in a million, 1 in 100,000 population. Therefore, if you have a clotting anomaly, protein C, protein S deficiency, where you have a clotting anomaly and you're on anticoagulants, maybe you may still take it. But the recommendation is 18 to 40. You have to be aware of this and immediately seek help if it is there. Otherwise, you can take these safely, there is no problem. So both in terms of safety, the data that we have so far is reasonably safe. In terms of international approval, only Covishield. So if it is international travel, pick only Covishield at this point of time. 1 month down the line, it may change. For Indians, it doesn't matter, one or the other.
Excellent. Thank you so much, Dr. Varghese. Just a quick question. It's exactly 4:32. Do you have another 10 minutes? How long more do you have, Doctor?
I have another live streaming webinar starting at 6. So before that, I have to reach home. That's all.
Okay, great. So could we go for another 15 minutes? Is that okay with you?
10 minutes, I would say. It's not here. I have to go home.
Absolutely, absolutely. Okay, couple of other quick questions. I think just on post COVID care, as in just how what are some things we should remember post COVID, and also what are some things we need to remember post vaccination. I think both there are a lot of questions on those two topics. Could you shed some light on either of those?
Post COVID, we are still learning the post COVID patterns of the problem that people are facing. Most common are related to body aches. Today also I had a patient coming, doctor, aches and pains all over. Very common. They don't come with frank arthritis. I ask them, do you have pain here in the joint? There's no. I have pain generally in the body. So body aches and pains, very common. That's the first part of the story. Second thing is tiredness. Now, the tiredness can be because of two reasons. One is because they have body ache and myalgias that are there, which is preventing them from taking a vigorous action. But the important thing to understand is the tiredness can also be because their lungs have been severely compromised. Maybe 2/3 of the lung is damaged and it is still in the recovery phase. And that recovery takes about 2 to 3 months. So during that period, it is common to have breathlessness on exertion, breathlessness on climbing stairs, breathlessness on walking. There is a small number where there is a tendency for long-term problems which are related to your myocardium, myocarditis. These are the people who have problems when they jog or do vigorous exercise. So we do not recommend vigorous exercise, jogging. So if I were to be on a treadmill, I can walk, that's not an issue. And for most people of average Indian height, walking is the speed of around between 4 and 5, between 4 and 5. Okay, but the moment you hit to 7, you're actually onto the jogging phase of your running phase of your treadmill. If it is 10, that is reasonably fast-paced jogging. So That is what you should try to avoid. Walking is allowed, maybe on a treadmill or maybe otherwise. I normally not in favor of treadmills because these are having a large carbon footprint. All treadmills consume energy, and anything that consumes energy has a carbon footprint. I'm an environmentalist. I like to be eco-friendly. I don't like energy consuming things. So I like to walk if I have to walk. I build a walk into my nature of work. I don't use the lift, I climb the stairs. And if I'm climbing the stairs, I have coronary disease, I'll be tired, I'll be breathless. I would then prefer to use the lift. So your tiredness can be linked to your lungs. Tiredness can be linked to maybe there has been a thrombosis in your coronary. It may be linked to that. You may need a cardiac opinion. If your heart rate is changing, you need a cardiac opinion. There is another category that is seen, which is long-term, 4 weeks down the line in children. That is known as Kawasaki disease. Kawasaki disease is a disease where there is vasculitis. Vasculitis means blood vessels. The blood vessels get inflamed, autoantibodies attack the cells, and they inflame the cells, and it occludes the blood supply to that area. So what do they have? Fingers turning black, gangrenous fingers. Hands turning black, gangrenous skin patches, or claudication from poor blood supply to a partially clogged artery. These are changes which happen in a small number of children. Early wave, in fact, in August, I'm in touch with my friends abroad. Internationally, there are about 35 cases reported. They were reporting it in the New England Journal of Medicine from Cambridge. But there are a number of reports now from all over the world. Here I talked to my pediatrician. Did you see any? Yeah, we have seen some, but we have no way of proving because parents never got the testing done because they never thought the child had corona. Child had a little cold, but we never could prove it. And the antibody tests for testing for the presence or absence of the infection is unreliable. Therefore, it doesn't work.
Thank you, Dr. Varghese. There are a couple of questions based on the medical fraternity and just
so post-COVID, yes. One more aspect I would highlight.
Go for it.
And that is, since lung is the major part of involvement, rehabilitation of the lung back to normal capacity is important. There is recovery in the lung that happens. It does happen. So your oxygen need should be off when you reach home. But occasionally there might be need in some people. So these are people who need to go on intensive chest physiotherapy. And what do you tell patients? So there is something known as an inspirational spirometer. It has those 3 tubes. You blow into it. 3 balls are there. One after the other, it will go up depending on how much you've blown in or how much you've taken your breath in. So that is inspirational triflow meter, which costs about 1,500, sometimes 2,000, sometimes 800. Some cheap brand will be 800. Lot of money. What do I tell my poor patients? Forget it. Go and buy a packet of balloons. Okay, and inflate 2 balloons every 2 hours. That's it, till it bursts. Keep blowing it till it bursts. Simple exercise at the community level, and every 2 hours, keep blowing 2 balloons. That's an excellent exercise. You don't have that, shops are closed, just do deep breathing. Deep breathing exercises. Very useful. Keep it regularly, every other hour and every waking hour you do it. That will help improve your lung capacity. The idea is to get your alveoli. All alveoli are not open all the time. The air spaces in your lungs, they're not all open at that time. They have to be recruited, and recruiting happens when we do deep breaths. So we train our system to recruit those closed alveolar spaces ordinarily to open alveolar spaces to have better oxygenation. That will reduce your tiredness. So chest physiotherapy is very important. And in these times of yoga, tell them for pranayam. Very happy.
Nice. Thank you so much, Dr. Varghese. Okay, one last one. I think we can slip one in here. I think this one's just going back to the steroids and anticoagulants. One is about the dosage. I think Ganesh had a question about what about the dosage of the steroids and anticoagulant? Is there a specific recommendation for that? And Timmy had another question about just the medical fraternity. I think since your video, I think millions have watched it, right? So do you feel like there has been enough adoption of what you've been saying over the last 8 months now Do you feel that shifting, that sort of tide shifting, or what are your thoughts on that, just in terms of how do people now who are getting treated, do you see any difference in that?
When the timeline struck me as something important, I knew internally it's a game changer. I knew it. And we discussed with some of our scientist friends. They all agreed upon, Mathew, you are on a totally new concept. You are on to a game changer. I knew that. But I tried selling this idea to people that I knew abroad, internationally, wanting to get it published. They all saw it, oh, very nice concept, but nobody was willing to take on and get it published. Why? Because it's not based on a randomized controlled trial. And if everything had to be based on a randomized controlled trial, you will have very little pandemic being controlled, because by then all your time would have been lost. And I tried pleading with them. In fact, yesterday morning also I sent a letter to a journal. I submitted it 4 weeks back. They have still not responded. They have not rejected it. The rejection happens in 24 hours. They have not rejected it, but they have not accepted it also. Until it comes in a medical journal, I know the medical fraternity will not accept it widely, but I know internally all of them are following it. It has gone to all the medical colleges. I have done webinars like this to medical colleges also. I have done webinars with doctors. Some of them said, sir, we are following your regime only, including the most premier of our India's centers. I'm not naming it because the doctors may be hounded, because doctors there told me, sir, there is a protocol, but we are following yours.
Nice. Excellent. Thank you so much, Dr. Varghese. And on behalf of all of us, I say thank you to you, and really appreciate the fact that you've taken this time out for all of us. And also thank you so much for the timeline video. I think in the last year, we have all got our own medical education. That probably was one of the easiest videos to have understood. And you have an amazing gift. And I'll say thank you. John, would you like to just quickly say thank you to Doctor and everyone else? Thank you.